The history of the Medicare planning fringe benefit. This is Charles Wright, Principal Advisor with Health and Wealth Advisors in Orlando, Florida. In 2017, while conducting research for marketing materials being submitted to CMS, I discovered a source of massive waste affecting the Medicare program. The Medicare secondary payer statutes were enacted in 1980 to protect Medicare from paying medical claims of self-insured employer health plan members. The unintended consequence of the MSP statutes is they prevent Medicare-eligible health plan members from easily transitioning to Medicare. It's estimated this problem has cost employer health plans and health plan members more than $1 trillion since 1980. In April 2019, with the support of Congresswoman Val Demings, I presented recommendations mitigating this problem to CMS, the Department of Health and Human Services, and the Health and Human Services Inspector General. August 2019, CMS responded. Though a small number of Medicare beneficiaries are automatically enrolled in Medicare Part B by mistake, changing the Medicare secondary payer statutes as proposed would not be in the interest of the Medicare program. The CMS response motivated the creation of the Medicare Planning Fringe Benefit in September 2019. November 2019, the National Association of Health Underwriters asked CMS to conduct a compliance review of the Medicare Planning Fringe Benefit to determine if the Medicare Planning Fringe Benefit violated the Medicare secondary payer statutes. CMS concluded that the Medicare Planning Fringe Benefit is entirely educational material, requiring no further review by CMS. This conclusion by CMS mitigates compliance risk exposure associated with implementation of the Medicare Planning Fringe Benefit. March 2020, I began collaborating with Lewis and Ellis, consulting actuaries, to apply actuarial methodology to quantify the cost-saving potential of the Medicare Planning Fringe Benefit. Lewis and Ellis determined the actuarial lifetime savings of compliantly transitioning each eligible plan member to Medicare is $76,541. August 2020, Dale Hall, Director of Research at the Society of Actuaries, challenged me to write a white paper explaining the Medicare Planning Fringe Benefit to the actuarial community. The white paper was completed in October of 2020. May 2021, white paper was published by SHRM, the Society of Human Resource Managers. May 2022, the Society of Actuaries published the sponsored white paper for download, recognizing the credibility of the cost-saving potential of the Medicare Planning Fringe Benefit. You are encouraged to download the white paper from this website. A growing number of Americans are working after age 65 for a variety of reasons, including good health, the need for income, or to maximize future Social Security benefits. A recent Pew Research study estimates that almost 20% of the U.S. workforce is represented by workers age 65 or older. These Medicare-eligible employees are typically enrolled in their employer group health plan. Most of these Medicare-eligible plan members have access to suitable cost-saving Medicare plan options. The problem is they don't know how Medicare works and can't compare the cost of their group health insurance plan with their most suitable Medicare plan options. The 2023 Kaiser Health Benefit Study found the average annual employer group health plan contribution to be more than $17,000. The average annual plan member contribution to be almost $6,600. Most eligible plan members would be better served in a suitable Medicare plan. Most eligible plan members choose Medicare Advantage plans with a $0 monthly premium. After the eligible plan member enrolls in Medicare Part B and transitions to Medicare, their employer saves an average annual benefit cost of more than $17,000 per eligible plan member. Eligible plan members save on average between $6,600 to over $10,000 in annual premiums and cost-sharing expenses. Everybody wins. Social Security gives workers the option to take benefits anytime between age 62 and 70, and it offers incentives to those who are willing to wait. Those who claim income benefits at age 62 have to accept 75% of what they receive at full retirement age. Social Security automatically enrolls early income benefit recipients in Medicare Part B at age 65. Most retirees either cannot afford to wait or don't think the trade-off is worth it. Yet, despite the prospects of getting larger payments from Social Security, 62 is still the most popular age for people to claim their Social Security income benefit, according to the government's most recent data. April 16th, 2018, Charles Wright, Principal Advisor at Health&Wealth Advisors, LLC, presented the following to the Secretary of Health and Human Services, the CMS Administrator, and the Health and Human Services Inspector General. Request for approval of an employer group waiver plan waiver that provides financial relief for Social Security recipients automatically enrolled in Medicare Part B while simultaneously enrolled in an employer-sponsored group health plan by allowing enrollment in a group Medicare plan, EGWP, without the requirement to be simultaneously enrolled in the employer-sponsored group health insurance plan. July 18th, 2018, the following response was received from CMS. After careful consideration, we have determined that waiving the relevant Medicare secondary payer statute and regulations would not be in the interest of the Medicare program. While we acknowledge that some working Medicare beneficiaries may have elected to enroll in Part B in error, we do not believe limiting the MSP rules as proposed is the appropriate remedy. CMS does not acknowledge the fact that automatic enrollment of Social Security recipients into Medicare Part B has the unintended consequence of creating waste and abuse for beneficiaries simultaneously enrolled in an employer health plan. The estimated annual cost to Medicare beneficiaries and employer health plans is over $30 billion, or the equivalent of about 5% of the Medicare budget. The Medicare Planning Fringe benefit was created to convert this specific Medicare program waste into significant employee benefit cost savings. Let's find out how this is accomplished. Large employers have the opportunity to reduce employee benefit costs significantly by offering the Medicare Planning Fringe benefit to Medicare eligible plan members. These cost savings are accomplished by educating Medicare eligible plan members about how the Medicare program works. Eligible plan members receive a customized Medicare plan comparison report. This report documents the known costs of the plan member's most suitable healthcare plan options. Exposure to this cost-saving information, along with consultations with a benefit advisor, compels most Medicare eligibles to enroll in a suitable Medicare plan. The Medicare Planning Fringe benefit provides a compliant process for transitioning Medicare eligible plan members to the most suitable Medicare plan option. Plan sponsors and plan members benefit from significant cost savings as a result of the employer offering the Medicare Planning Fringe benefit. Mary Smith just turned 66 after working for the Acme healthcare system 20 years. Mary plans to work until she's 70. Her husband John is 67 and retired. John is a dependent on Mary's health insurance plan. John has Medicare Part B. Mary pays $480 a month for their Acme group health plan. If John wasn't on her insurance plan, Mary would pay $240 a month for health insurance. Mary learned about the Medicare Planning Fringe benefit, which helped her understand their Medicare plan options. Mary and John completed the Medicare Fact Finder. After receiving their Medicare plan comparison report and completing their telephone consultation, Mary and John made some decisions. Mary has decided to enroll in Medicare Part B. Then she and John will enroll in $0 monthly premium Medicare Advantage prescription drug plans. Mary and John's transition from the Acme Group Health Plan to Medicare Advantage PPO plans will save them almost $12,000 a year in premiums and cost-sharing expenses. This is what Mary Smith's Medicare Plan Cost of Ownership Summary looks like. What compels the transition to Medicare? Medicare eligibles motivated to transition to Medicare after being exposed to the known cost of suitable Medicare plan options is explained by the economic law of substitution. The economic law of substitution was established by Austrian economist Hermann Sarich Gaussen in the mid-1800s. The economic law of substitution generally states that consumers want to get the maximum satisfaction for what they spend for goods and services. Let's use Medicare Supplement Plan F to illustrate how the economic law of substitution would apply. Medigap Plan F is the most comprehensive and expensive Medigap plan option available. The benefits provided by Medigap Plan F are regulated by CMS. The price of Plan F policies is determined by each individual insurance carrier. Regulated benefits provided by Medigap Plan F policies are the same for all insurance carriers. The price of a Plan F policy is the primary variable differentiating Plan F policies among competing insurance carriers. The economic law of substitution predicts that when the benefits of a Plan F policy sold by different carriers are the same, the lowest price Plan F policies will be preferred by consumers. Suitable Medicare plans are those plans that satisfy the minimum level of benefits required by the Medicare beneficiary. If the known cost of Medigap Plan F is less than the known cost of the employer health plan, the plan member will generally prefer Medigap Plan F. The economic law of substitution is the foundation of price competition. The Medicare Planning Fringe benefit introduces a new form of price competition to the large employer group benefit marketplace. Acme Healthcare System has 5,000 health plan members. 10% are 65 or older, representing 500 Medicare eligible plan members. Acme Healthcare's management has decided to offer and promote the Medicare Planning Fringe benefit to their 500 Medicare eligible employees. It's anticipated that 80% of their eligible plan members will transition to Medicare within 12 to 36 months. Assume each eligible plan member costs this self-insured employer around $25,000 in annual benefit costs. After 400 eligible plan members complete their transition to Medicare, eligible plan members will save over $2 million in annual premiums. Acme will achieve nearly $10 million in annual employee benefit cost savings that drop to the bottom line. The break-even point for recovering the $500,000 Medicare Planning Fringe benefit cost is the transition of 20 eligible plan members to Medicare, or 4% of their eligible plan members. Will a CFO approve a $500,000 benefit cost to achieve $9.5 million in savings? Most would, if the Medicare Planning Fringe benefit pilot project is successful and supported by the actuarial opinion. The Medicare Planning Fringe benefit delivery process starts with launching this new benefit to your eligible plan members. Eligible plan members can respond by downloading the Medicare Plan Finder app or completing the Medicare Fact Finder online. Your benefit representative will be available to assist completing the Medicare Fact Finder upon request. After the Medicare Fact Finder is submitted, a benefit advisor will prepare and email the eligible plan members' deliverables. Eligible plan members can schedule a Medicare consultation with their benefit advisor, who will answer all of their questions until a Medicare planning decision can be made with a high degree of confidence. The eligible plan member can complete the online Medicare plan enrollment process themselves or assisted by their benefit advisor. The benefit representative collects the Medicare Planning Fringe Benefit feedback forms. Most eligible plan members will transition to Medicare the first day of the month after enrollment in a Medicare plan. Your company is invited to sponsor a Medicare Planning Fringe Benefit pilot project. This is an opportunity for a minimum of 25 to a maximum of 100 eligible plan members to experience the Medicare Planning Fringe Benefit. There's no charge for participation in a pilot project. When the pilot project sponsor proceeds to full implementation, a $1,000 service fee will be charged for each of the sponsor's eligible plan members. Project sponsors are responsible for fees associated with production of the actuarial opinion required for each pilot project.